What causes type 2 diabetes? We all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. When you have type 2 diabetes, your body still breaks down carbohydrate from your food and drink and turns it into glucose. The pancreas then responds to this by releasing insulin. But because this insulin can't work properly, your blood sugar levels keep rising. This means more insulin is released. For some people with type 2 diabetes, this can eventually tire the pancreas out, meaning their body makes less and less insulin. This can lead to even higher blood sugar levels and mean you are at risk of hyperglycaemia. Is type 2 diabetes serious? Around 90% of people with diabetes in the UK have type 2. It is a serious condition and can be lifelong. If left untreated, high sugar levels in your blood can seriously damage parts of your body, including your eyes, heart and feet. These are called the complications of diabetes. But with the right treatment and care, you can live well with type 2 diabetes and reduce your risk of developing them. Managing type 2 diabetes. Learning how to live with type 2 diabetes can be challenging, but we'll help you to discover what works for you. Some people can manage it through healthier eating, being more active or losing weight. But eventually most people will need medication to bring their blood sugar down to their target level. Can type 2 diabetes be cured? There is no cure for type 2 diabetes, but some people are able to put their diabetes into remission. This means that your blood sugar levels are healthy and you don't need to take diabetes medication anymore. Remission can be life-changing, but it's not possible for everyone. Treatments for type 2 diabetes. There are a number of different ways you can treat type 2 diabetes, such as making healthy lifestyle choices, using insulin or taking medication. Your healthcare team will help you to find the right treatment for you. This can reduce your risk of developing complications and help you to live well with diabetes. Signs and symptoms of type 2 diabetes. When you have type 2 diabetes, your body can't get enough glucose into your cells, so a common symptom is feeling very tired. There are also other symptoms to look out for. These include feeling thirsty, going to the toilet a lot and losing weight without trying to. The symptoms of type 2 diabetes can develop more slowly than the symptoms of type 1 diabetes, making the condition harder to spot. That's why a lot of people don't get any symptoms, or don't notice them. Some people also don't think the symptoms are important, so don't ask for help. This means some people can live for up to 10 years with type 2 diabetes before being diagnosed. Risk factors of type 2 diabetes. There are several factors that can affect your risk of developing type 2 diabetes. Because the symptoms of type 2 diabetes are not always obvious, it's really important to be aware of these risk factors. They can include your age. If you have a parent, brother, sister or child with diabetes, your ethnicity, high blood pressure, being overweight. We've got more information about all of the risk factors, as well as a Know Your Risk tool that can help you discover your risk of type 2 diabetes within minutes. Learn more about the risk factors of type 2 diabetes. Newly diagnosed with type 2 diabetes. Knowing where to get started following a type 2 diagnosis can be a challenge. You may feel overwhelmed, but it's important to know there isn't a one-size-fits-all approach to managing the condition. As well as using the information on this page to understand your condition, you can meet other people with type 2 diabetes in our learning zone. You'll hear advice from others in your position, and get practical tools to help you feel more confident managing your condition. Want to know more? Whether you are newly diagnosed, looking to improve your diabetes management, or in need of information to support others, we are here to help. We've got lots more information about preventing type 2 diabetes. Did you know that with the right support, up to half of type 2 diabetes cases can be delayed or prevented? Our information about preventing type 2 will show you some of the steps that can help you take to reduce your risk of developing the condition. Checking your blood sugar levels. Checking your blood sugar levels is an important part of managing your diabetes, so we'll take you through how to check them and what your readings mean. And we've also got more information about what happens your blood sugar levels get too low, called a hypo, or too high, called a hyper, so that you're aware of the signs and symptoms to look out for. Living with type 2 diabetes. Having type 2 diabetes can bring up lots of questions about your lifestyle, but we're here with the answers. From nutritional advice and recipes to help you know what to eat when you have type 2 diabetes, to guidance about keeping active and staying fit, we're here to support you. We've also got more information for different age groups, such as young people and older people, as well as practical school advice for parents of children with diabetes. Type 2 diabetes is also associated with other health conditions, such as thyroid disease and dental problems. It's important to be aware of these, so make sure to read our information about diabetes-related conditions. Your emotions. Type 2 diabetes is a complicated condition, and it may seem like there's a lot of information to take in. If you're feeling worried or stressed, we've got emotional support and advice that you may find helpful. Diabetes technology. For some people, managing their diabetes with technology can be life-changing. But we also know it can be overwhelming if you're not sure where to begin. Our information and guidance about diabetes technology will help you understand what the different types of tech do and how to access them, so you can find what works for you. Thank you for watching the video. Don't forget to like, subscribe to my channel and comment your opinion. Finally, click on the link in the description for more useful information and how to fix your situation.